Hello, and welcome back to the second part of this viral video series, Understanding Viral Illnesses. My name is Jennifer Norton, and I'm the Health Services Coordinator for the Hempfield School District. I'd like to invite you to help me and our school community spread facts, not germs. There's so much media attention right now on the coronavirus, but we need to keep this discussion going all the time about all illnesses and infectious diseases. So what our best avenue is to spread truthful information, be transparent, continue this dialogue, keep the conversation going, use reliable evidence-based sources, and not spread germs so we can all stay healthy. I'd like to discuss a little bit about herd immunity. We in the Hempfield School District, we are a herd. We are a community of people. We spend a lot of time together. Our herd immunity is strengthened when we do things to minimize the risk of spreading illness among the members of our herd. These illnesses can be restricted by using healthy practices and immunizations. The more people who stay healthy in our herd and the more people have vaccinations, the less illness we can expect or diseases we can expect to see in our herd. And the important thing about that too is to remember that a lot of members of our herd, such as the elderly, infants, and other immunocompromised community members, may not have as good immunity as other people. So the healthier we stay, we're not only protecting ourselves, but we're protecting our fellow members of our herd. I'd like to talk a little bit about viruses. This is a fantastic demonstration of how contagious some viruses can be. And on this diagram, you're going to see a number of familiar sounding viral illnesses. In the upper right-hand corner, right here, we have the influenza. And this, the flu, seasonal flu, the yellow dot in the middle represents a person who is sick with the flu. And if they were to be around 20 people and be contagious around those 20 people, the flu is contagious enough that we would expect to see about 2.5 of those 20 people then become also sick with the flu. And this is how disease starts to spread. The coronaviruses, which are a family of cold viruses, and more specifically, the COVID-19 virus, which is the illness that is in the news right now, so far is showing a similar profile to the flu virus, meaning that one person who is infected in a group of 20 can expect that 2.5 people may become infected from being exposed to that person. The important thing to remember with this COVID-19 virus is 80% of the people who may become ill with this are only going to exhibit mild cold symptoms, and children are actually less likely to exhibit severe symptoms of the COVID-19 virus. Rather, populations that are at risk are adults over 70, immunocompromised folks, and possibly pregnant women. I'd also like to take a moment to bring your attention to other virus-borne illnesses such as measles, mumps, and rubella that are also vaccine preventable. These illnesses are also spread much like the flu and the coronavirus through respiratory droplets. There are vaccinations and immunizations available for these. These illnesses in relation to things such as the flu and the coronavirus are actually even more contagious. You can see here that measles, if a person is infected with measles and exposes themselves to 20 people in a group, it is likely that 15 of those people will subsequently come down with a case of measles. So a little bit of history on viral illnesses. Viral illnesses have been around for a very long time. In the 1920s, there was the Spanish flu. Currently, we are in the middle of a seasonally expected flu season. About 10 years ago, we had H1N1 as a novel flu virus. Currently, coronavirus is in the news. And more importantly, COVID-2019 is in the news. The important thing to remember about coronaviruses is this is one of the organisms that's most responsible for the common cold. We've already all had probably a coronavirus sometime in our lifetimes. Viruses love to mutate. This is why we can't ever get rid of them. They're constantly changing in response to treatment and the environment around them. Since they are not bacterial, antibiotics are not useful to treat viruses. There are no vaccines for coronaviruses yet, but they are in development. There are vaccines for other virus caused illnesses such as the flu, chickenpox, measles, mumps, and rubella, and many others. This novel coronavirus is getting attention because it's never been identified before, meaning it's not been seen under a microscope in the scientific community. And the reason it's getting so much attention is because it's believed that this coronavirus started in the animal species and then transferred to the human species. And anytime we see interspecies transfer with a viral illness, that's always going to get a lot of attention because that could be a stronger or more virulent illness. In closing, I would like to share this wonderful video by the World Health Organization that gives more details about the coronavirus. And I would welcome you to contact your school nurses, your healthcare providers, to get additional information or other evidence-based resources such as the CDC. I'll be adding one more video to this viral video series about all ways that we can keep our health and safety good during this flu season and during illness season, and I hope you'll join me for that. Thank you so much.
In December 2019, there was a cluster of pneumonia cases in China. Investigations found that it was caused by a previously unknown virus, now named the 2019 novel coronavirus. In this video, we'll take a quick look at what's currently known about the virus. Keep in mind that this is a new virus, and what's known about the virus now might change in the future. Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China. It initially occurred in a group of people with pneumonia who'd been associated with a seafood and live animal market in the city of Wuhan. The disease has since spread from those who were sick to others, including family members and healthcare staff. There are many cases at present, and the disease has spread within China and also to a number of other countries. So, where did the virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known yet. How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. So, how does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider. That's a quick look at this emerging infectious disease. Given that this outbreak is evolving rapidly, what's known about this virus can change. Please check the websites below for the most up-to-date information.